Thank you, Chairwoman. Um, wow. So I'm going to go to what I prepared because I do think that, in Representative Langworthy's district, if we actually passed this resolution and did the things that the Ways and Means Committee, that the Budget Committee have asked for, there are 133,971 people on Medicaid in his district, including 50,582 children, 44,000 people on SNAP, and 9,000 people get the Affordable Care Act premiums that the Democrats passed to help people afford their health care. And it would go up by about $1,900 a year. And this budget resolution would cut taxes for the ultra-rich and pay for it by cutting benefits for Americans. And Chair Arrington, for cutting benefits in your district, in my district, and across rural America. Because you can't say it's not going to happen. It says in the resolution, it directs that there will be $880 billion cut from Energy and Commerce Committee. And for folks listening out there, you might say, what the heck does that mean? Well, Energy and Commerce is where we have Medicaid coming out of and paying for and authorized. It's where we have these health insurance premiums. And your resolution directs or asks or encourages that there be $880 billion. And then the other thing is the Republicans, this is their wish list. The Republicans' wish list sets out a whopping $2.5 trillion in cuts to Medicaid. That's a lot of cuts. These are lots of pages of cuts and cuts and cuts, the things people rely on. You know, Chair Arrington, you and I share a border. I am often really close to you. When I'm out in my district, I'm like just a few miles away from yours. So you know how hard it is in our districts to find a doctor, our rural districts, hospitals, rural health clinics, and they're struggling. And Medicaid, for many of these rural clinics and hospitals, is essential. Do you know how much money Texas hospitals receive in Medicaid payments?
Not offhand, so you can tell me.
Okay, it's $8.3 billion in Medicaid payments in 2023. And these payments are key, and especially in rural hospitals. I visit my rural hospitals a lot. I'm really pleased that the ranking member of Energy and Commerce, Frank Pallone, he has visited with my rural hospitals because they describe how tight their budget is. They describe how they are very worried about where we have to improve Medicaid, not cut it. And they tell me, like your Rolling Plains Memorial Hospital and your rural health clinics associated with that they need these Medicaid funding. And we also know that Medicaid really has very little compared to other health systems improper payment rate. It's about the same as the private sector, about 5%. And then those are usually somebody just inputted something wrong and it gets fixed. So that's the problem, is people rely on this. So let me ask this. Do you know how much Medicaid funding they get let me turn to my dear colleague here in the beautiful state of Pennsylvania.
Could you repeat the question?
How many, no, I'm going to ask, I'm with Chair Arrington because these are rural districts. He's
Oh,
got
I'm
a
sorry. I
big
thought you said
rural area.
Pennsylvania.
And I know you've got a rural area too.
She said, dear friend, so you know she meant me.
Oh, my dear friend. So in Pennsylvania, you probably don't have it at your fingertips, but these are things I care a lot about, Chair Arrington. So I pay attention to what is happening in other states that have rural districts like mine, right? Because my hospitals in my rural areas, which are actually, I need to tell you, predominantly Republican, They're coming to me and asking me, so I know that my colleagues across the aisle have the same issues in their districts. In Pennsylvania, they get about $2 billion. And you know, somebody actually, because I have friends in Pennsylvania, checked in with the Commonwealth Health System in Geisinger, two major health systems that you're aware of, Ms. Scanlon. You know, these are in Representative Bresnahan's district. One of them gets, CHS gets 15.7% of its revenue for Medicaid. In Geisinger, it's 18%. You can't have a system that gets this much money from Medicaid and start cutting it without putting it at risk. And am I right, Representative Scanlon, that you lost some of your rural hospitals because they couldn't handle the needs?
We're seeing that across Pennsylvania, but not too many rural hospitals in my district.
Yes, I know, not in yours. That's why it was interesting where others were reaching out to me. And when we let these rural hospitals go under, when we cut the funding that they rely on, you're not just cutting the funding for Medicaid patients. You're killing that hospital. And when you kill that hospital, you kill the ability of farmers, ranchers, people on private insurance to be able to get access to health care. You know, in small towns and areas like yours, Mr. Chairman, you know, more of our communities in those small towns rely on Medicaid than maybe in urban areas, and I know you have both. So I want to just point out and ask to put into the record a report from Georgetown University that pointed out that non-elderly adults and children in small towns and rural areas are more likely than those living in metro areas to rely on Medicaid CHIP for their health insurance. Madam Chair.
Without objection.
In New Mexico, nearly 60% of kids in small towns and rural areas rely on Medicaid and CHIP. In Texas, do you happen to know how many kids rely on Medicaid and CHIP in Texas, Mr. Chairman?
It's always too many.
It's always too many. It's 239%, 14.3% of your rural kids rely on Medicaid. In Representative De La Cruz's district, 178,000 people rely on Medicaid. 135,000 Pennsylvanians rely on Medicaid in Representative McKenzie's district. 159,000 Pennsylvanians in Representative Bresnahan's district rely on Medicaid. And I think it's important to remember who they are. In my district and across all these rural areas, it's farmers, it's ranchers, because they often don't earn enough or have access to private care, nursing home residents, kids with disabilities, moms who just had babies. My dear Lord, these are caregivers, veterans, and sometimes people working two jobs. They're your voters. Madam Chair, I'd like to enter into the record a tweet by Elon Musk. That says that Americans love Doge because watching Trump slash federal programs knowing it doesn't affect you because you're not a member of the parasite class.
Without objection.
Mr. Chairman, is the mom who just gave birth and is on Medicaid a parasite?
I don't believe you mean that seriously, because you, as my neighbor living in the broader region of West Texas and eastern New Mexico, know better than to think I would ever refer to a fellow American as a parasite.
Exactly. And that's why we cannot stand when the person who is behind some of these cuts believes that those who rely on federal programs are parasites. A woman who has breast cancer is not a parasite. People who rely on Medicaid and SNAP and nutrition benefits are not parasites. As you know, Mr. Chairman, they're our neighbors. although when you were last here, Chair, in rules last year, I asked you to explain how the Republican cuts to 22% of world programs, how we could describe that. Because in my community, those world programs provide water, nutrition, healthcare. They provide electricity. They help keep kids healthy and alive. And you told me that I'm going to quote you, tell them we have to prioritize. When I read this budget resolution, I see it as prioritizing tax cuts and handouts for the people like Elon Musk and the rich over health care for working class Americans. Elon Musk earns $4 million an hour. The people in the communities that you and I love, Mr. Chairman, don't get anywhere near this amount. Now, Ranking Member Boyle, I'm not, we might be joined by yet another, but we've had some questioning on some issues, and I'd like to give you an opportunity to respond, because I'm kind of the last Democrat. They've got 9, we've got 4, and to respond to some of the issues that may have been raised here today.
Well, I'll just say one, and that is I'm, sometimes at the kitchen table with my daughter, helping with her math, and her math teacher is big on showing your work. Got to show your work, not just arriving at the correct number at the end. So I thought that I would show my work on one important aspect, because we've heard competing claims today where we have pointed out accurately there are $880 billion worth of cuts that have to come from Medicaid or Affordable Care Act premiums or some combination of the two. The other side has said, oh no, there's nothing in there that even mentions the word Medicaid. Here's the reality. This budget resolution directs Energy and Commerce to reduce the deficit by a floor of $880 billion. Now, if Energy and Commerce decided that they didn't want to touch Medicaid, that they were going to honor Donald Trump's words when he said he would, quote, love and cherish Medicaid, what that means is ENC, Energy and Commerce, even if they cut 100% else of everything they have control over, that would only get them about halfway to the $880 billion figure. In other words, by definition, in this budget resolution, you have to cut Medicaid by at least hundreds of billions of dollars, at least. So I want folks who are watching at home, when they're hearing these competing claims and they hear intelligent, well-educated people on both sides throwing around these numbers, it's important for folks to understand what they really mean. Make no mistake about it. This budget resolution cuts Medicaid, the Affordable Care Act, education programs, and many others to at least partially pay for $4.5 trillion of tax cuts that mostly benefit the top 1%.
Thank you, and I think it's really important to also go through and point out that we're not just making this up about what this will do. There is very precisely, they want to extend the 2017 Trump tax cuts. And it's very clear that those tax cuts did a couple of things. That one, they increased the deficit, as you correctly pointed out. Madam Chair, I'd like to ask unanimous consent to enter into the record the chart. Tax cuts, Great Recession, COVID-19 are responsible for the growth in the U.S. debt ratio, which actually makes clear, if you care about, I'm sorry, I don't let you say yes. I ask unanimous consent.
Without objection.
Thank you.
I want to point out to the gentlewoman that she had now spoken for 15 minutes. And we would like to finish this up before we go to vote, if at all possible.
Well, thank you.
Thank you.
And I would like to point out that there are only 4 of us, or three of us, and I think that's important. Others spoke for just as long, so thank you very much. I'll note that. That, as you pointed out, Trump tax cuts were the largest contributor of any one president to the deficit. Is that, can you repeat how you did it?
So what I said was that the largest increase in the national debt in percentage terms happened when Ronald Reagan was president.
Yes,
But the largest total amount added to the national debt of any presidency was $8 trillion by Donald Trump from January 2017 to January 2021.
And so this budget resolution would take us down that path again. We would be doing a repeat of the 2017.
This budget resolution is a Republican betrayal of the middle class. It is trickle-down economics supersized.
Right. And Madam Chair, I'd like to also enter into the record the 2017 Trump tax law was skewed to the rich, expenses, and failed to deliver on its promises.
Without objection.
And what this does is actually show that the trickle-down economics that were promised didn't occur, and the idea that we were going to see, and working families were going to see, this tax increase, well, it was touted as something that was going to happen. Study after study showed it did not benefit working families, that $5,000 did not magically occur, and that indeed, that it benefited, as we've been saying, mostly the wealthy. Is that how you looked at the records?
I mean, what I would say is rather than my own numbers or my own words, I just refer to the Congressional Budget Office that found that 83% of the tax cut, 83% of the money went to the richest 1% of Americans, and approximately half of the money, or half of the tax cut, went to the richest 1/10 of 1% of Americans.
Thank you. And with that, Madam Chair, I yield back.